What is this? Okay. What is this? This is. Y'all ready?
Yeah. Just let us know when you're ready for us to speak.
Good afternoon, good afternoon. Welcome all.
Yeah, good afternoon.
Welcome to another episode of Barbershop Convo Series hosted by Unisex. Today, we're going to be talking about food insecurity within our community. My name is Sabrina Darius, and I'm one of your hosts.
Yeah, and I'm Sharon. I'm a host.
Thank you all for joining us. Hopefully this is going to be a very stimulating conversation, bringing awareness about food insecurity in our communities, and hoping that we get some solutions, some resolutions after all of this.
And just to shout out Barbershop Convo Series a little bit, if you guys have been following us and just everything we've been able to do over the past year, we've touched on so many topics. Perinatal loss, maternal loss, we've touched on mental health, we've touched on blood cancer awareness, we've touched on financial literacy, voting rights, so many different things, and it's all kind of tied in together. So even though it just seems like such a broad range of topics, you know, we're covering all these social determinants of health, which is something I'm quite sure we'll go into much deeper and further, but just really quick, these social factors that can impact our health, and one of them is food insecurity. And so that could segue right into
exactly what food insecurity is.
Yeah, but before we're gonna just tell a little bit about
ourselves.
Who we are. Yes.
Yes. As I stated earlier, my name is Sabrina Darius. I am a health and wellness educator with over 20 years experience working in the social service and hospital sectors, providing advocacy work, advocacy services for communities that are disadvantaged. So I am excited to be one of the panelists here to just bring some awareness and then hopefully come up with some solutions as to how we can move forward and do better in our communities when it comes to getting proper nutrition, getting access to food, and other resources as well.
Yes, and me, Sharon Turnage, wear many hats, licensed social worker, licensed addiction counselor, also nonprofit owner, Talent and Coke Foundation, where we help bring awareness to perinatal loss, maternal loss, reproductive justice, the Lewis Danvers Leukemia Fund, where we bring awareness to blood cancer. It's different cancers like leukemia, sickle cell, lymphoma, and then also I'm a third-year PhD student, right? Well, no, all but dissertation. Yes, and my area of expertise is reproductive health. Now, connecting it back to the topic, I've always looked at it from the socio-ecological lens. And when I say socio-ecological, is how environmental factors impact our health. So once again, food insecurity can impact your health. And so Sabrina is going to cover the first question, which is, how would you define food insecurity?
Okay, so food insecurity is a household level economic and social condition that limits or makes it uncertain whether people have access to safe and nutritious food, right? So what I mean by that is that people in general, whether when I say safe food, processed food, there are a rampant amount of stores in the area that doesn't necessarily provide the most nutritious food, and we have limited access to it in some communities. So bringing awareness to food insecurity in terms of what a food swamp or a food desert would be, which I know that you're going to touch upon it. We're going to throw a lot of different vocabulary, introduce a lot of different vocabulary that may not be common language that we use on a regular basis, but it's they all interplay with each other. So food insecurity is basically looking at the economics, right, in the region that certain communities live in that don't necessarily have access to the proper food, right?
Exactly. And just understanding, for instance, to connect it back to Queens, New York, because of course the barbershop is based in Queens, New York, with Jamaica, Queens. And so there's research that shows just in Jamaica, Queens alone, that not only is there food insecurity, but there's also what we call Jamaica, Queens, there exist food deserts, right? So throwing these terms at you, but I'm gonna give the definition of a food desert. So a food desert is an area that has limited access to food that is plentiful, affordable, or nutritious. In contrast, an area with greater access to supermarkets and vegetable shops would be called a food oasis, right? We know that Queens is a food desert, so let's just kind of look at what this looks like. I know the neighborhood, we have 1, 2, 3 grocery stores, 4. Within a couple of a mile radius, right? But out of those stores, how many of those stores offer very healthy options, very affordable options? How many of the stores do that? And so, like, let's take for instance, in Queens, we don't have a Trader Joe's, right? Or what's the other? Or like a Whole Foods. How many stores sell, like for instance, there is a building not too far that they sell health foods, right? But how many grocery stores really are those healthy food options? Not too many in the area. And so then there is the situation where residents of this community right here are going to either have to buy unhealthy food, the healthy food that is extremely expensive, so you can't get enough of it, you're gonna get just enough, which is gonna impact, especially if you have a large family, right? And then also we have bodegas, fast food, liquor stores, smoke shops, all of these variety stores that are unhealthy in nature and definitely outnumber all the healthy alternatives.
And then you gotta take into consideration too, like how you said, when we did a Google search, right, to find out what was in a particular neighborhood, and you're looking at supermarkets that are, like you said, about a mile away. Some people don't have access to vehicles, right, to get them to these locations. So if having a convenience store in the neighborhood makes it convenient, right, where they would opt better to shop at a convenience store, where the foods, like you said, are not necessarily of the best quality, the most nutritious, right, but but it may be more cost effective, more affordable for them because transportation may be an issue. So then this brings a discussion of how do we bring back these stores into our neighborhoods so that we can have better access to quality foods.
So I think as a consumer, we kind of tell people what it is we want. So if we're buying certain foods, more of those kind of stores are going to pop up. So one thing, and just for instance, we have the liquor stores and we have the smoke shops, but they're able to exist because people are, going to them, right? If there was like a Whole Foods where people still even shop in it, and then like I said, of course, there's an issue where those foods are way more healthier, but then maybe more expensive, right? So if I have to determine I'm gonna get these soups because I can get more for the money, even though they're full of salt, full of, preservatives and everything, you're gonna do that because ultimately too, if you have to choose between making sure you have food, whether it's healthy or not, you're gonna make the choice to have enough food to feed your family.
Yeah, I agree to a certain extent because that's where I'm so excited about this combo series in terms of how City Cuts has been able to build upon the variety of topics that we talked about, right? So in terms of like getting involved with the government, your government, local government, right? Because if we are not privy to certain information, if we're not engaging with local government, then we can't, impact the changes that we need, right? Whereby they would see the need of the community to bring about more options for the community, right? Because we're like not even looking into we're talking about supermarkets, which is great, but when they do the studies, the reason why supermarkets are not readily available in certain neighborhoods is because it takes up a large amount of space, which affects taxes. Which if a supermarket owner is going to have to pay higher taxes, then the burden actually goes on to the consumer, and prices of food is higher. So then that makes it this difficulty in people being able to afford adequate food because now the prices are high. So I think that it's great that the fact that you've introduced topics where people can get involved with local government and actually put these requests on the books and make demands so that they can bring incentives right into the community so that food becomes more available at a decent price. And the fact too, education is something that is of importance, that we need to find ways to educate the consumers even more about how do you grow your own food, right? Those are options. How do you get involved with local community co-ops where they actually have gardens, right? If you can't do it on your own, then there's co-ops available that you can plant and grow, or even get involved with your local farmers, right? And support your local farmers. Just even coming up in this direction, as I was counting, what was available in the neighborhood, there's a person out, right by the shop, actually selling watermelons and fruits, right? And so that's something that's also an option that we need more and more of it, right? It was alarming to think that 44 million people experience food insecurity. And out of that 44 million, 13 million of them are children, right? So those are things that we need to become more aware of, and just we need to have this conversation.
We're gonna go to the next question. Because you're right. I mean, I have a whole bunch to add to that. We're the ones that are not demanding these
Right.
things be in our community.
Right.
And I'm just gonna say as a point, let's look at the smoke shops. They're all over Queens. You do not see them in Long Island, right? And I don't think it's that you don't see them in Long Island because they just can't afford to be there. There are people that are not allowing those things to come in their community. So as a community, we have the power for what we want in our community. We can demand what we want. We vote the people in for what we want. But then we have to make it a priority that this is what we want for ourselves. You know, and nobody's even talking about food insecurity, let alone banding together to say, how are we as a community gonna do something about the food situation, food crisis really that we're dealing with in our community. You know, it has to be what we want, you know. So that's why I'm saying it can go so many ways. You know, we have to, and maybe we don't know that we have the power, right? That's probably why the community needs more empowerment, more engagement. But at the end of the day, we literally have the power
To affect change.
to affect change, but we have to want it. Like, as a community, we have to say, we need healthy food, right? And then we need to figure out ways how to come together to get just that. So that's why I feel like, you know, that's even a whole nother different aspect. So what are the underlying causes of food insecurity and how can they be addressed at local levels? So that was kind of what we were just saying. I think some of the underlying causes of food insecurity is in certain communities where they do have food deserts, they probably have lower income, right? That lower socioeconomic status. They, like you said, transportation. Because even if I go to the store, how am I bringing the food back, right? I have to have a way to get there. I have to have a way to bring the food back. There's neighborhoods where they don't even have to go to the store. They can order the food and it can be delivered or picked up. But of course, those communities probably have more resources than some of the other communities. So then there lies the issue, you know. Besides that, the education, like you said, how much do we as a community talk about food? Let alone talk about the scarcity of food. We're not even talking about food, the health of food in itself. The food we digest, is it healthy, is it not healthy, whatever. We're not even having that conversation.
There's just so many social issues that, you know, this conversation will open up like a whole can of worms, you know, like definitely the unemployment, definitely poverty, definitely low wages, housing, all right? Even climate change, like if we go on like a grander level, even like conflict within the government, because a lot of our foods are getting outsourced from other countries, right?
Look, even the bridge that went out. Even the bridge, because I remember seeing that whole thing and they were saying that that was one of the biggest ports for like that really, you know, that source to all up and down the East Coast. And so that bridge being out, delay of food, one thing with food is food has that shelf life. So now if I can't get the food where the food needs to be quick enough, right, then that food is going to be wasted, right? So how much is it just not even just not having access to food, but making sure the food is delivered in time so that the food is edible, sustainable, yeah. And how many, even like restaurants, like we have places that have food, and because they can't have the food past a certain shelf life, does that food get then redispersed?
Food waste, and that's a big issue. Food waste, and how do we even begin to address and combat those issues? You know, because they're like, I was doing some studies. It's like over 100 million worth of food is being wasted because of the fact that it's not aesthetically pleasing to some, or like you said, if there's an overconsumption of certain types of food, like how you were talking about the demand. If a community demands X amount, but now they supply you with more than what you need, so what happens to that excess?
Exactly.
So
You're
that's
right. You're right. And then the healthy options that's available to not just families, but then kids in school.
yes,
Options to the homeless, which is a whole other thing. How are they eating?
right,
So if you're homeless, you don't have a place to store your food. You don't have to, so how are you getting access to food and everything else? And then there's another problem, you know?
right. So you have to depend on, outside entities and agencies to supply, right? To supply you with what it is that you need just to sustain yourself, right? And a lot of people may not be aware that there are, resources available, like food pantries, your local churches, right?
Another thing, like you said, food pantries available, the local churches ensuring that food gets out. But if I don't know where these locations are, if they exist,
Right.
What's the times that I can get the food, what's the procedure in getting the food, then I still won't have access to the food.
Exactly. So which, again, education is key. Knowing what is available in your communities, linking with your local government, right? Even schools and hospitals, believe it or not, hospitals have started initiatives, right? I know Franklin Hospital is one of them, but that's in Long Island.
But that once again,
Long Island, and they have resources for people in the community that can come and get nutritional foods, right? Fruits, vegetables.
And I'm happy you brought up that point because I think it's not just up to the supermarkets, right? If we're saying food is health, then it needs to be the hospitals,
Right.
it needs to be the organizations, right, to help fight this battle.
Right.
It needs to be, the hospitals need to be at the forefront. They need to help us identify, the food or just help with the community awareness, or just as patients are coming in and seeing the doctor, like maybe going over some key factors or whatever. It has to be a community effort. Providers, organizations, dedicated community members to really come together and tackle this. But, because that's what the question was, right? Yeah, talking about the solutions. The elected officials, and that's the final thing to add to that, they are crucial because they have funding that can get to the right organizations that can ensure that we get access, to the proper food. As community members, we need to start really digging deep into who these elected officials are. What do they stand on? What doesn't matter to them? What does matter?
Right. So we do need to be more informed, more engaged. It's our civic duty and responsibility. I believe that there was a panel once before, right? On civic duties and responsibility and voting and things of that nature. So we as consumers need to make certain demands ourselves, because if not, then there's no collaboration, right? We need to work together so that we can come up with a solution and begin to address some of these insecurities that we're facing within the community. Because food insecurity ultimately leads to other things in terms of your health, like how you were saying, your physical health, your mental health. Can you imagine not knowing where your next meal is coming from, not knowing how you're going to access that, not knowing how you're going to feed your family? That's like a huge mental.
And the fact that food feeds your brain.
Right. And your body. So you need it. So these are definite conversations that definitely need to keep. We need to keep that at the forefront, right? Because it impacts a lot. If you're not healthy, then what can you do? You're limited, right?
Yeah.
So food is definitely something crucial, right? And if we're not addressing some of the food insecurities, because we could have nutrient deficient, right? Which is causing things like obesity. It's causing high blood pressure. It's causing diabetes, and all of these are like comorbidities that's affecting our community.
So, then can I ask you this question?
I hope I can answer it.
Oh, I think you're good. You're doing good. You're doing good. What innovative technologies and agricultural practices can be leveraged to improve food access and affordability in rural and urban communities?
Well, okay, so there's a few things, right? So using data to make decisions, like actually doing the research and knowing the numbers, right? If you don't know the numbers, then you don't know like your starting point. You don't know what you're fighting. So definitely using technology, because again, all of this advancement that's taking place with AI and all these other things that are coming up. So technology is definitely something that can be utilized in addressing some of these initiatives. Innovative production technology, even down to like how they have now vertical farming. I don't know if you know those.
I know what it is. So it's like those. Yeah.
It's like a hydroponic planting system, and
yes.
it goes up, and you're able to, instead of like having to grow wide, you now are able to scale up.
Exactly.
So all of these great innovations, even like I currently am working with a STEM program, and we're working with the kids and teaching them how to plant. These are kids as young as age 5 to 11, and teaching them, like you can actually take a seed from one of your fruits and regenerate it, right? So that you can now produce more.
Once again, it goes back to the waste.
Yeah.
Because we can use what we have to make more food. Mm-hmm. And just because we're in an urban community doesn't mean that we can't have spaces.
That's true. And there are space available, but we're not like utilizing it for that. But which is why I'm like super excited about working with these kids, because they created in front of their school a garden. Yeah. And every day we're going out and we're watering, we're tilling the soil, and they're learning like that they actually have the ability that they can grow their own food that way. And those spaces are available. And
I love that to connect it, what you just said, to connect it to this question, because what can we do to improve food access and affordability? We need to use every single space.
Right.
So if it's school, like they're using the outside spaces, businesses could use their spaces.
Right. You can grow in containers.
Yes.
You can actually grow in containers. Right? Like even if you don't have access to like you're in an apartment, people are growing inside like in little pockets.
Yes. They're growing in apartments.
But we need to educate and let people know that they have these options. So right?
It sounds like every question we done said education. Education.
Yeah.
Education.
Education is power. Once you apply it. Mm-hmm.
So then, next question, how does socioeconomic factors such as income inequality and access to education contribute? We kind of answered
that.
So then let's go to the next one. How can community-based initiatives and grassroots efforts help alleviate food insecurity in underserved areas? Well, we can start with this initiative right here. Yeah. So listen, Barbershop Convo Series, right? Mm-hmm. Monthly touches on topics that impact us in the community on a day-to-day basis. And so this event right here is a community-based initiative to really help solve this problem, at least in our community. And so if I can suggest anything to anybody out there, it doesn't matter how powerful you are, because you don't need power to impact change. It doesn't matter how uneducated you may feel on the topic, right? Mm-hmm. Because we live in a day and age that everybody got a what?
Mini computer. Sure.
And everybody got access to what? Google.
Yes.
And so even if you don't have anybody that's vested in your community, right, that's talking about it or doing something about it, or that you don't realize is doing something, you have access to Google where you could Google what is food insecurity, and you can specifically touch on what is food insecurity in, let's say, if it's Brownsville, Brooklyn. What does food insecurity look like in Brownsville, Brooklyn? You can Google, is there any food deserts? Are there any healthy options? What are the food pantry locations? What churches are giving out food? What community-based organizations are educating? And then another person, and I'm going to say this because we did our voting, we did the voting, what you need to know about voting, and in that we discussed so much about how the elected officials work for us. So if you want to know what's going on in your community about anything, you go either knock on their door, or you call them, or you email them, and you say, listen, I live in Jamaica, Queens, and everywhere I go, there are no healthy food options. What does that look like? Where can I go? And what can I do to ensure that I have the food? Because see, they're the ones that work for us and really lay down the policies, right? That can literally help, change this. You said it earlier. You said, people setting up these supermarkets, the pricing, and then the taxes and everything. Why can't our elected official write in policy that if somebody is willing to bring a more healthy, affordable supermarket into the community, that they can get rebates and initiatives, or even the local government teaming up with that supermarket, and it'd be a collaborative event. It could even be something where a hospital can help fund, along with the politicians, along with some of the community-based organizations, and make sure that these spaces pop up. Or even if it's not a full-blown supermarket, ensuring there's space for people that are willing to come in and start making, doing the work that needs to be done to ensure the food is available.
So that definitely with the tax incentives, and I know that there is a push in trying to get business owners to come in and build these supermarkets. But unfortunately, you're looking, it's starting in areas that maybe are more middle class areas, and they need to start looking at people that don't really have the access. So, but I think that there is a push, and they're trying, right, to give the incentives. Another thing is too, when we talk about and this is why the civic conversations are so important, because if you cannot get to your local supermarket, there are a lot of elderly people, that are on a fixed income, and they don't have access to transportation.
And they don't have people that's willing to represent them too.
Right.
To ensure that happens.
So how are they getting to and from a local supermarket? It's difficult.
And then you have organizations like Meals on Wheels that, provide seniors, right? Food, but then we once again go to the social determinants of health. If I have mobility issues, with a lot of seniors may have or may experience, I may not even get to the door to grab that food, right? So who's gonna go around and ensure these seniors or disabled individuals get the food that is needed, and even understand the food?
And that's where I love what you said, that it has to be a collaborative effort, and that we need to really start defining what providers are and what their roles are.
Well, girl, I just did the research, right? Because I'm coming off my fellowship.
Yeah. So
And so in my, yeah, you explain it, because I talked about it the
Well,
other,
no,
yeah.
I mean, because a lot of people probably were not,
Yeah,
part
so
of that conversation, so.
basically, I do perinatal loss, and in looking at just that one situation, which is no different than any other situation that we're struggling with in our communities. But the definition of provider, as people think providers, they think, well, the doctor, the nurse, maybe not even the nurse, they think the doctor, all of these people, but we're really providers.
Right.
If we're in a position where we can provide the help and the care that is needed, that then puts us in the realm of being a provider. So we have to open up the lens of understanding, wait, the students at school are providers,
Right.
because they can literally start growing food
Right.
at the school and make that food available to families.
Right.
And then they would actually be a provider. And that's why, in my mindset, I want us to stop thinking these people that have so much education and they got certifications and these are who the providers are. We all have to listen to them and go to them for care. No, we are actually the providers in our community. And so, yes, that definition really needs to be expanded. I'm doing an article, so I will be expanding on that article.
Wait to hear it, but it's true. Like, definitely we need to start changing our definition of providers so that people become basically more accountable.
Yeah.
And so that they understand that resources are available and they're actually part of their own solution. They can actually provide their own solution, their own resources with just a little bit of knowledge and education and just application as well.
And it's so, and doing that also, to just say to you guys, that is so important because it actually strengthens that family microsystem, right? Because you guys are working together to solve some of your issues just on that micro level. And then out in the community, that's how you're doing it on a meso level. And then going to the politicians is how you hit it on that macro level. That's how we need to be tackling a lot of what's going on in our communities. On that macro, meso, and micro level. And each of us fits somewhere on that spectrum, because when my son was diagnosed, and not to go off topic, but when my son was diagnosed with cancer, I knew that his eating had to really, really just improve because I needed that to fuel his body to fight the disorder. And when I made those changes on how to introduce just eating a lot of vegetables and fruits, staying away from some of the cancer, causing. Yes. We did it as a family. We sat down as a family. We talked about what we needed to do, talked about what we should take out. We agreed as a family to eat that way. So that's why I'm saying, just as that microsystem, we work together, right? And it needs to be that systems type of functionality when it comes to how we solve this issue. Because even if I bring the food in, my kid doesn't know to eat it.
Right.
My kid doesn't understand why, right? And so we have to start educating ourselves enough where we can then come to the table with what we know to do something about this.
And we also have to look at the fact too, in terms of it probably is more convenient, right, to get something of lower quality because it's more cost effective.
Yeah.
But not realizing or understanding there's a correlation to how it's impacting us on our health level. Look at how you just said with your son.
Yeah.
You had to remove a lot of these cancer causing agents
that I never even thought
that
about.
you didn't even think about
At the time.
But those cancer causing agents are what is considered to be, more economical, right? It's easier to get, you said something about the
like those, those jar progressive suits.
Right, I wasn't gonna name names.
Oh, sorry. I ain't not trying to knock anybody, but like, yeah, because like for instance, I remember at Stop and Shop, those progressive suits, they'll be 10 for 10.
Oh yeah, I remember.
They'll be like $1 a can, and then a lot of times the store go, you don't even have to buy 10. You can just get 5 for 5, right? So now, wow, I got lunch for Monday, Tuesday, Wednesday, Thursday, Friday, right? Or if I get 7 cans, that's lunch.
Right.
$7. To whereas maybe getting some salmon expensive.
Salad. A bag of salad is expensive.
Bag of salmon. How long is the
How
shelf
long can
life?
it last? Right.
Rice, right? The jasmine rice. What the price of that bag is double the regular rice, but then we know the jasmine rice is so much more healthier. It's all these. It's like you sort of gotta play Russian roulette. Like, I can't really afford this. This is a lot more affordable. How we gonna make it stick? But and this is definitely bad. So I'll kind of stick in the middle, right?
But then this is where when the government does intervene, like SNAP benefits, right, where you can actually use your SNAP cards, right, to actually get better quality food.
First of all, SNAP. I worked for HRA, 1990, over 10 years. And let me tell you something. I don't care who you are and how much money you make, right? If you can get SNAP, get it. It is another resource. We gotta stop looking at things because they're trying to make things look like, oh, it's SNAP.
Right.
No, SNAP is another available resource. And what I'm trying to say is, when it comes to this whole food insecurity issue, do you know, and just looking at the monies, right? So the government gives the SNAP program funding, right? They also fund big businesses that have millions of dollars. And do you know they also get welfare? They get welfare, right? They'll call it is a grant or assistance, business assistance. No, it is funding. The same way, and they'll say SNAP as like the welfare or public assistance, right? To give it that name. Why? Because the faces we see online, right? They're the black and brown, and so that discriminatory stigma bias behind it. So a lot of us don't take advantage of SNAP because we like, I don't want to seem like the person that's swiping the card. Right. Let me tell you something. They give me SNAP, I will be at the store swiping away. I'm not sharing. I will be cooking some good meals because food is expensive. You have to understand that they give you assistance. You cannot be ashamed to take advantage of it for 2 reasons. One, because we are not even the majority that are receiving the assistance, right? For 2, just because you walk in a welfare public assistance office and you see nothing but black and brown people on that line, let me tell you something. So when I worked there, we had an office in the back, right? That got applications from the community. And a lot of those communities were not us. And they went into their local office, filled out the application, and then a community representative then goes to the office and drops those applications off. And the reason why I'm telling you this is because they're not necessarily bringing applications from our areas, they're having us get online. So because we're not seeing the representation, we're tending to think it's us. And then that adds to the stigma and the bias, right? No, what we need to start doing is having community organizations open up spaces, put a social worker or somewhat advocate, and let people go in those communities and fill out their applications and have them dropped off. That's just the same. Like, you know, it's so unfortunate because it looks so different depending on the community. It looks so different, but we're not different. And like I said, we're not the majority even getting the assistance. And even the people that are getting the assistance because their neighborhoods are better set up, those SNAP benefits could go even further. But what we need to start doing is figuring out a way where we can bus our people to their own nice neighborhoods and take advantage with SNAP cards, you know, like having that opportunity.
A lot of these
Whole Foods Trader Joe's takes it.
So another thing that you said about busing them into like certain communities, there are accessorize, something that's available that people are underutilizing.
Now,
they're not good.
Yeah, that's another thing people are ashamed to utilize. If you're disabled, you need accessorize. You need to be on accessorize, and I didn't mean to cut you off. The good thing about accessorize is because I was once an accessorize recipient, I would continue to be one. I am not ashamed, but they wouldn't let me recertify. But I don't know if people actually know my history, but I actually had a very, very severe car accident. In the process of just healing, I wound up breaking a leg. And I mean, I took two long years that I could barely walk, and I had accessorize. First time in my life. First of all, you get on the accessorize. I think up to 4 or 5 people get on the accessorize with you.
I think they changed it now, right?
I'm not sure because I know somebody was telling me 4. So, like, if you have to go to the store, it's not like you're saying, well, I still have to go by myself. No. You take your kids with you. They can go, you know, to the store. Accessorize drops you from door to door. You know, we have to start knowing the resources that's available to us and then taking advantage of every single resource.
Right. And making sure that you stay in the loop of what's happening in like the political realm, your local politics, right? So that these programs are not defunded.
Yes.
Because people are not realizing, you know, there's a saying, like if you don't
use it, you lose it.
So it's becoming aware of that.
That's right, because working at Medicaid, whatever budget, let's say if it was $100 million that they received, whatever wasn't used had to go back. So you gotta understand, you guys, these agencies would love the maximum amount of people to get on these, you know, to utilize the services, because then it lets them know there's a need and they could probably even get more funding instead of us underutilizing it. And then they looking at it like, well, they don't really need it, so we'll cut funding, right? We have to show that there's a need, because other communities are there letting them know exactly what's available, exactly where to get it, exactly how to get it, and nobody's ashamed, right? Because as a community, they want to take advantage of every single thing that they can take advantage of.
Right. We have to learn to be more demanding. We have to demand certain things within our community, right? And then that will get the conversation going on the local government, and then we'll bring it state level until they can impact on a federal level. So, like you said, that you're building on a micro to a macro level, right?
Micro, yep. Going to the meso. So, like, this right here is a meso, right, community event that is available to all community members, and not just in Queens, just people, period. It's live streamed for a reason. So no matter where you live, your situation may be a little bit different than what we're experiencing here, but food insecurity is food insecurity. So just being able to have these meso level community initiatives is everything. But like I said, I think there's power in that family dynamic, that family structure. Because a child could go to their teacher and say, well, why aren't we growing our own food at school, right? A teenager could go to their university and say, why aren't we educating on food insecurity and having food alternatives available? And then a person can even go to their job, like, why aren't we holding all these systems that we utilize accountable? Why aren't our jobs allowing for spaces where, you know, food could be produced, even for the employees?
And that's where you become inclusive and then you start creating solutions. So we do have the power to change and affect a lot of these changes going on. We can actually demand it, we can come up with solutions. And look at how you're looking at it from all levels. We're starting at the grassroots, which is your own first, right? And recognizing that there's an issue, there's a shortage, there's a problem. Now, how can we combat it? What solutions, what steps can we take as a family to begin to change some of these things that's taking place as it pertains to the food insecurity? You know, and like even when we went back with, you know, the waste that we, like if you go through your cupboard, I'm sure that there are like things that you're not using, but instead of throwing it in the garbage.
And see, but we have to make smarter choices, because how I do is I buy what I know I'm gonna eat.
Okay. Right. But there are a lot of households that are not doing it.
And what I know how to cook.
Right.
What I know has the nutritional value. So for instance, and this is to everybody out there, I want you to download an app. And it's called MyFitnessPal.
Oh, yes.
I don't know if you can type it in. MyFitnessPal. I want you to download that app. And not just because I use the app to lose weight, right? Because it tracks your food, right? What I love about MyFitnessPal is it lets you know how much of the nutrients is in the foods, right? So, you know, are you getting, you know, your protein? Are you getting your carbohydrates? Different things. And then it also is good with, like, you can set, well, I want to make sure I get this amount of healthy food in my system every day. So now it can help you kind of figure out what foods, figure out how to connect it and everything. And so that's so good. Like, I just think it's so super cool.
And it's free.
And it's free.
It's free.
It's free. and that's the thing. We have to start looking at free and very low cost, minimal cost.
And like you said, Google, like you pointed out, like we have access. You know, there's a lot of community events taking place, even in the hospital, where they hold workshops on nutrition, and they have even your local library where they'll do food demonstrations on, you know, how to incorporate more of the food into your diet.
And I think a food incubator, I want to make sure that I got the exact reasoning, but I think even a food incubator too, right?
But there are a lot of resources available in the community if you're willing to go outside of it. Look into the resources available. Like this platform is giving out the information.
So like I said, the food incubator, it's a space for people to be able to make food, right? So we already talked about growing the food, but now maybe you want to feed the community or just have healthy options available, not to the entire community, but who you can feed, right? So the food incubator is either very low cost or sometimes even free kitchen spaces for you to cook the food in.
Those are options. And even like soup kitchens. Like your churches have, a lot of the churches in the community sponsor events where you can actually go in and get a decent meal, right? Yeah. Meals on Wheels program that you said, God's Love We Deliver is another.
Yeah.
And so a lot of them, and that's why we go back into the whole provider conversation, because a lot of them can stem from from your doctor's office with a social worker that can connect you to these resources.
I know there's dietitians, you know, and I do see, and then it goes back to your health insurance, because I truly believe that some health insurances, and I'm gonna look while I'm sitting here, do give you the option of speaking to a dietitian, like that being included in your insurance.
Yes, it is. It
So,
is Medicaid or private insurance, you have access to a dietitian and nutritionist. Yeah. And they can actually, you know, put in referrals for you so that you can, you know, be part of certain programs where you can have access to these quality foods. And the education, like, you don't necessarily need to depend on somebody delivering the food to you, but like just teaching you like what goes together. Like how you said, My Fitness Pal, you plug in what you have and it creates a menu. AI, ChatGPT can go into whatever product that you have in your refrigerator that's healthy, can create a whole meal for you.
it says it right here. I have Emblem Health, you guys.
Yeah.
And it says medical nutrition therapy and access to counseling surrounding. Wow.
It's available, but you have to know what, you know, based off of your insurance and based off what's available for you, and not to be afraid to seek out and not to look at it like how you said, even when we were talking about the SNAP benefits. You know, let go of the stigma, let go of the shame, because this is, at the end of the day, this is our health. Our health, our
As a matter of fact, that should be like your credit card, because at the end of the day, you know that's going to ensure that you have access to healthy food.
Right. Yeah.
So, question. This is it. So, what are the cultural and social implications of food insecurity, and how can diverse perspectives be incorporated into solutions?
Well, we actually kind of touched on it, because even when we gave the example of you working for HRA and the SNAP benefits, where you said, you know, it looks like it's us, but in reality, it's not us.
And also, looking at it culturally from the perspective of, as, like, from our cultural background, how we eat it, right? How is the food? Are we cooking the food healthy? Are we putting a lot of, you know, are we eating a lot of foods that are not necessary? You know, the cooking, I think it's important. And then too, when it's a cultural norm, it's easy to be like, maybe you should eat that, but if that's a part of your whole, you know.
For many of us that are in the community of Black and brown people, right, generationally, we've been taught how to eat, right? And it's not necessarily it tastes good, but it's not necessarily the good for you type of food. You know, a lot of us grew up on,
because I grew up
on high fat food.
I grew up on candy yams, macaroni and cheese, rice and peas. My mother was from the South, so
oxtail,
chitlins, get ham, and you know, all of it.
Right. And it's not necessarily like, you know,
and big portions.
Right.
So like, you gotta fill, like Thanksgiving, you gotta fill the whole plate. Like you can't even see nothing, and it has to like stick up maybe about. And that's not a plate. If the plate don't look like that, then that's not Thanksgiving. And then a lot of and just to think about culture, a lot of our cultural activities or festivities is circulated around food.
Yeah.
Right? So like 4th of July, what we gonna all have a barbecue, right? If somebody has a birthday, we'll get together and food and then alcohol. Oh, we didn't even get to
that part.
The alcohol. Because I don't drink, so I always feel like I'm not really one that can talk, because whenever I talk about alcohol, people say, oh, but you don't drink. So I don't think I have to be a drinker to know that I don't drink for a reason, right? Because for one, the calories, right? For two, recently, somebody high profile had an issue with alcohol. I think they passed away through the alcohol. And they were saying how the minute alcohol, that it's not even good to even drink that one glass of wine. Because the minute alcohol gets into your system, it inhibits the brain cells. It does damage to the brain cells. We're not even talking what it does to your liver and your kidneys and all the other organs, right? But we know, I'm quite sure there is a connection between communities that have a whole bunch of liquor stores in it, and then looking at the health of the community. And I'm quite sure a lot of the people in the community have their dialysis, just all different things, repercussions that stem from, the alcohol use. For food choice, because that's a poor food choice. If you're drinking everywhere you go and 3 and 4 and 5 drinks, that's a poor food choice because there's no nutritional value in the alcohol at all. They say it is with the wine, but then I saw research that said even the wine, it's still alcohol, And then we have to understand if we're eating bad, then we're drinking, and then we're smoking, and then we're not getting exercise, and then we're not even getting outside because we just went through a pandemic where we were stuck inside, so that stale air, right? Not getting outside, getting the oxygen going through our body and everything, and all of those things result in bad health.
Yeah. So we just have to be more knowledgeable about what we're putting into our bodies and how it's affecting.
No, first of all, we have to care.
Right.
Because I also think there's a connection between what we feel about ourselves, how we love each other, and how we eat. And not knocking anybody, not here to judge anybody, but I think I was talking to my brother and I was telling him, when you put that self-esteem on high and you start thinking about, I want to look a certain way, I want to be able to move around in the world a certain way, then you have to look at what you're taking in. If you're getting enough rest, if you're drinking enough water, because we didn't even touch on the water aspect. I don't think we're digesting enough water, right? How many people drink the recommended amount of water every day? And our body is H2O,
Or other sources like fruits. Fruits have a lot of content.
But once again, if we're not taking in the right amount of fruits, then we're not getting the water, because you don't have to drink your water only. You can eat your water, but if you're not gonna identify foods that are very high in water,
Content in water, and just like how we can go back to the whole culture thing, right? So watermelon, right, has a high level,
yes, it does.
high level of water in it, right? And it does the body good. But because culturally,
But I was gonna say,
what we're taught,
there's a stigma.
there was a stigma, right, for a long time about watermelon, and so a lot of people steered away from it.
And not just the stigma, but a racial
Right.
context, right? Where, especially as Black individuals, and then from the South, first of all, that was a income source, right? But then they turned that into a whole discriminatory, racist connotation when you think watermelon and you think Black people. I don't even have time to get that deep.
I know.
Because that's a whole nother, and I like to talk on what I'm an expert about.
Right.
But we're coming off, as Black people, we're discriminated against. So that's obvious. And so there's a concerted effort to make sure that we don't have access to food. I know it's culturally wise, it's because of who we are, the color of our skin, and that's why I'm saying the caring concern has to be also on a micro and definitely a meso level. As a community, we have to want to see ourselves healthy. As an individual, we have to want to see ourselves healthy. And, you know, I've been able to make a lot of choices in my life, not because I'm better than anybody else, but because I'm demanding my health.
Right. Because you understand the power of what's in your health.
And so that's why I don't drink, because people think, oh, you're a nerd, you don't do nothing. Yeah, I don't do it because it's going to destroy me at some point. When you're younger, you could do all those things, but those things catch up with you when you get older in age.
Right.
And, you know, I'm not getting any younger, and I do understand that just as a Black woman, that also comes with its own share of health issues, right? As Black women, we, you know, have heart issues. You know, we have a very high rate of heart issues. Already have issues reproductive wise, which we didn't even have to cover. But you know, diabetes and all these other different things that run rampant in our community. So I think, and we don't want, not trying to get deep, but we have to fight against that concerted effort that is out there trying to ensure that we're unhealthy.
That's a limited statement. I hope they quit that.
I don't know if they might.
So. Yeah.
Okay, yeah. And I mean, I have to be honest because I'm not just a provider, but I'm a Black woman.
Right.
And I also come from the hood, and not meaning in the hood in a negative way, meaning I come from, in my opinion, those underserved, you know, communities that, because so much more, as rich as Jamaica Queens is, so much more needs to be done for the residents here. And I know that, and you know that, because there's food deserts here. And out of all New York City, what was it, Corona, Jackson Heights, and Jamaica Queens?
Right.
But Jamaica Queens is the one community, neighborhood in this country, the one neighborhood in this country where Blacks have a higher income than whites. And that I learned very long ago when I was doing research.
And yet, so then it goes in line that it doesn't necessarily
Go by socioeconomic
even though
status.
it is a socioeconomic issue,
Issue.
but you're looking at the fact that even in the middle class,
Yes.
there's still
I'm gonna tell
some
you guys.
insecurity.
I'm gonna tell you guys what the median income is.
And also
in
take into
Jamaica
consideration that she's doing, putting up the numbers, you could be middle class and still have food insecurity because of the lack of knowledge that you have in terms of what the nutritional value of the food is. Again, we go sometimes with what's convenient for us, that we're neglecting, you know, aspects of getting proper nutrition, right? So even as a middle class, education, you would think that the more educated you are, the more knowledgeable you would be, but that's not true. Like in doing my research, I was realizing that, you know, medical professionals, they go to medical school and they have one class in nutrition.
Oh yeah.
One class in nutrition.
And we didn't even have, well, me as a psychotherapist, we didn't have anything on nutrition. I mean, I covered it because I sought out that knowledge, but
and
it
nutrition
wasn't.
impacts everything, right? Nutrition impacts everything.
And I don't even think that one class was for them. It was just for them to get a real foundational, which is nothing. A foundational understanding is absolutely nothing.
Right.
Means nothing.
So that as you went back to saying, it starts with the whole self-love thing, right? Like you have to know what is of value and importance for you so that you can now go out and seek out the information, seek out the resources and the help, right? Because again, just because you have all the education or just because you may have some money doesn't necessarily mean you're going to make all the right choices as it pertains to your health if you're not seeking it. So I don't know, you're getting numbers?
Yeah. So, and I just want to look up what the national average, yes, okay. Yeah, because 48,000, and that's like a minimum, and I know the national average is about that.
The income?
75 and 100,000 is different parts of Jamaica, Queens, and I'm gonna do United States median income, and I think it's about 48. $37 is the U.S. median income. So in Jamaica, Queens, the lowest is showing 48,000, then 75,000, and then 100,000.
And if you take that and then the rise of inflation, right? How food is becoming more expensive, then you're looking at housing expenses. Because usually when you're working, the first thing you're thinking about is keeping a roof over your head. So a good portion of your income is going to housing. It's going to utility. It's going to transportation. So what's left for you when it comes to food? Which is why you saying that anyone who can, it's a good idea with the SNAP benefits. Like you should not look at it just off of your income. You should go get the assistance if the assistance is needed, and not to feel shame over it. Because $100,000 a year, if that's supposed to be on a higher level,
and they said high in 250
to live in New York City, Jamaica,
Queens. But compared to the U.S.,
right?
Those numbers are very good. So then, how do we have food deserts in Jamaica, Queens? No, that was it.
Oh no! Wow, we actually did really good considering everything that was going on behind the scenes. But again, I like how we always end with having
a call to action. Yeah. Well, I think because we can give the information, that doesn't mean people know what to do with it. Mm-hmm. So that's why I always try to do a call to action. So what's our call to action?
Well, getting more involved with your local providers, right? Seeking out resources in the community that you can utilize, right? Where, if there is shortages of food in your house, there are pantries. Actually getting up and doing the work, Googling, getting involved with your local government, right?
Right in this neighborhood is Adrian Adams and by Rochdale. What's the other lady? Was it Latasha? No, it's definitely Natasha. Let me see. I'm gonna put elected officials. I don't want to say her name wrong. Jamaica Queens. So Adrian Adams is right there on the side of Rochdale. She services probably Baisley, even up to 40. Definitely Rochdale, I believe parts of Springfield. We're gonna get the other lady that I'm gonna get her name. She services. So the senator for Jamaica Queens is Leroy Comrie. And I'm gonna tell y'all right now, he is the man. And I'm just telling you, not because any other reason other than he came to me when he saw I had a need and wanted to do community-based initiatives, and he gave me a space and an opportunity. And I didn't have to find him. We need people they need to come to us. They're working for us, they need to come to us. So he's definitely the truth. The congressman, so I think Meeks, yeah, I think he does, because this is saying Grace Min. What we're gonna do is we're gonna get all the information, and we can get the barbershop to post it maybe. So I'll get all the information. I definitely know the one
Natasha Williams.
Yeah, Natasha Williams. I knew it, and I don't know her personally, but I know people that know her, and they said she's the truth. So
St. Albans.
Yeah, St. Albans, right? Maybe Cambria, and maybe like Queens Village. I'm thinking maybe some parts of Addis Lake Park. So what we're trying to give you guys is, if you want better food options, start by calling them, walking in their office. If enough people walk in there, and this is an election year, if enough people walk in their office, they're gonna start talking food insecurity all up and down.
Yes.
Merrick, Linda.
Demanding better options, better supermarkets, more supermarkets in your neighborhoods. Instead of not to infringe on other people's ability to make their own money, but instead of having every corner, like I can go into like less than a mile radius, and you can count how many McDonald's, Burger King, KFC, Popeye, Chinese food.
And I'm even guilty at times of going there and getting food. But what I do though is I always choose the healthiest alternatives at those spaces. So like a McDonald's, I would get the crispy chicken sandwich because that's chicken breast. Just thinking, being mindful. That would be better than a Big Mac or maybe a quarter pounder. So it's just like, we don't always, even just for time constraints, or maybe I can't go home and cook a whole meal. I need a quick, fast alternative because I just don't have the time. Identifying what those healthy things are. You know?
And that's what's called a food slump, having all of these like restaurants, fast food chains, and these, corner stores, right? Where there's food available. There are grocery stores. You can actually go to a grocery store. But when you look at the environment where we're at, more of those food chains are readily available than the actual supermarket. So it'll be one supermarket and then 10 different chains of restaurants, right? So you're giving options of these 10, but they're not necessarily the good for you options, right? So that's all part of, how a food swamp, a food desert, and food insecurity, and you're looking at that cycle, right? So those are the things that we need to be like more cognizant of. And like you said, all these it's an election year. And you know that there is an issue within the community. But if we're not going and demanding, change is not going to take place. So this is why, like the call to action I'm saying, right, is start demanding change. Start like if you're starting from you as the individual, now you're moving up to the local government, local officials, right? And going out and demanding that why can't we have a Trader Joe's in this neighborhood?
Sure could.
Why couldn't we have a
And let me tell you, and it would be packed, and people would be able to afford it. But once again,
you have to demand it. You have to recognize that there's a need, that there's an issue, right? And that you have to demand change to take place. And you have to go seek out those resources. You have to seek it out, because it's not gonna, like, you're lucky how you said someone came to you and gave you an opportunity. But not everyone's gonna be as fortunate as to have somebody coming to them, right? So sometimes you have to go outside and demand certain things.
but also, and you're right, and also the reason why he came to me was because I was in them streets.
Right.
Hitting that pavement, not even thinking that he would align with me, but just getting out there and just demanding certain things as a mom, for my son. And then that just turned into people taking notice. They want, you know what? These elected officials don't know what we need. We gotta tell them. They don't know. They're tapping onto the causes as they're seeing fit, because that's what's coming to them. If we started talking about food insecurity and demanding the food, I'm telling you, they would start having them conversations. They would have like a town hall or whatever and start demanding what it is that we want. Because there's enough spaces where food could just start growing. Enough empty lots that could be turned into spaces to produce food.
Plenty. So this was great. to some of our community's issues and concerns, and actually providing some real good solutions and resources for us. So I know that there's a next session coming.
Yes,
right?
4 o'clock.
Mhm.
You need to tune in at 4 o'clock because it's gonna be financial literacy. We've talked a lot about socioeconomic status, about income, about lack of income, right? So now we're telling you, we got another, session that's gonna give you that information. So not only will you be empowered about the food, but now you're gonna be empowered about what to do as far as money is concerned and understanding it. So, and remember, the barbershop, and once a month, come to the website, the Instagram, the Facebook, right? The schedule will normally be on there to let you know what events is coming up. But there's people in the community trying to make it happen. Now you guys gotta step forward and now start taking advantage.
And share this information, because if we're not sharing and we're not utilizing it, and it's like, it's gonna go to waste, right? Again, if you don't use it, you lose it. So here's this opportunity where someone has come and created a platform for us to have these conversations, and they're really good, poignant conversations that take place on a monthly basis. So take advantage of it and share, and then let's work together. Like how you said, grassroots. Let's put our feet.
First of all,
to
the grassroots is what works.
Yes.
It's the people in the community that I said it at another event. When you get sick and tired of being sick and tired, then let's start coming together and solving what we need to solve. Because nobody's gonna care about us more than us. Like who do what for us by us?
Yeah.
Like, come on now.
So let's take the initiative. Sharon, it was a pleasure. I love sharing with you. Love being on the platform with you. And we want to take a special shout out to Nikki.
Yes.
For holding this down, because if it wasn't for her allowing us to utilize her space, this is her brainchild and your brainchild, right? You guys came together and you actually put together a phenomenal platform so that we can put this information out and then hopefully really impact change and begin to change the trajectory of our lives and our children's lives, our families' lives, our community. It takes one step. It takes one step. And we thank you, Nikki, for giving us this opportunity.
Definitely.
Yes.
Definitely. It always gets, a lot of people always say how appreciative they are, even if they don't show up here, when they're looking at the videos, they're learning, and they're talking about, wait, I heard this, I didn't even know about this.
Yeah.
And it's those little sparks. Because I remember doing an event and I said BIPOC, which is us, Black and Indigenous people of color. And everybody was like, never heard that. And then the same people was like, yeah, because BIPOC individuals, like, we gotta just, those little things, you'd be surprised how people are yearning
For the information.
Right.
So we thank you, Nikki. Thank you.
Thank you for your expertise. Thank you.
So part 2 will resume at 4 p.m.
Yeah, 4
So
p.m.
we look forward to those of you that are.
And it won't be us,
right? Won't
but
be us.
it'll be an amazing panel.
Yes.
It won't be us.
Yes. So stay tuned. Thank you.
That's a wrap.
No, I wouldn't.